Welcome to medical college. It's a great place to work.
Good patient care starts with a team, and the team has to be, starting with the physician and the patient working together to work for a common goal.
I set mutually agreed upon goals. It's not about me, it's about we.
Well, no matter how busy I am, you only have one chance to make a first impression. And so I like to engage them right away by making good eye contact and basically sitting down.
I think a lot of times providers can talk at patients and not really hear what they have to say. And so I think good patient care is just making sure that you really hear everything that your patient is saying.
So what I try to do is to really understand who the individual is, what you care about, what are you passionate about, beyond your disease, who are you?
I just take the time to let them tell their story.
Tailoring the right decision for the right person can be good patient care.
It's always a good idea to have an understanding of who they are, so to read the note beforehand or get some background information, because we have that technology now rather than just running in and then sitting down on the computer and then start typing right away.
I always dictate my clinic notes and write in something that's personal about the patient so that I can ask them about that in the next visit.
I present myself as non-judgmental and listen and meet them at wherever that means that they're at.
What's a good visit? It's the right amount of education so that the patient and I are both working on the same goal and the same outcome that is going to be achievable, so that there's not disappointment in things that could be, avoided or averted.
Over the past many years, I've changed from this basis of thinking that good patient care meant the patient has to have the best possible outcome based on the perception of others, to understanding that the best possible outcome is what the patient perceives as their desire, their outcome.
So good patient care to me is a shared goal and a shared relationship where they trust me and I trust them.
Oh, absolutely.
Absolutely.
They're imperative.
They're extraordinarily important to know.
Well, they're critical.
Oh, patient stories are incredibly important to know.
One of our sayings in our clinic is it's all about the story, actually. So I think it's really important. And I try to teach our residents and fellows and med students, we put up an MRI or an X-ray, and I try to say to them, we're not operating on an X-ray, we're operating on a person.
What brings you here is a pretty profound question, because for some people it centers on the symptom, for other people they just want knowledge, other people want cure, which I think we have to be circumspect about, but their stories are really important.
We can be very easy to interject with a question, or interject with a clarification, or interject because we're short on time. And it really only takes that 2 to 5 minutes for the patient to complete their thought.
I think the patient story is why everyone originally went into medicine. It's the impact that you were looking for when you decided to go into medical school. And I think if you don't highlight those patient stories, you can kind of lose track of that and get caught in dashboards and metrics. And none of us are here to make their dashboard look better. They're all here to help patients in a meaningful way.
People's stories are fascinating to me, and I think that's why I enjoy medicine as much as I do.
I think patient stories are probably the most fun part of my job.
Just being a new provider myself, I think there's a lot of things you don't know. And if you try to change the world in one day, you're going to be defeated.
I think being unafraid to ask for help and to have more than one set of eyes look at complex cases is really important, not to feel too proud to do.
I think new providers would benefit from being able to listen and learn from not just the patients, but also actually the nurses, the medical assistants. There's a lot to be learned, and remaining humble in that process will serve you well.
Early in practice is a really great time to make connections. Instead of calling somebody on the phone, I always tell people to go walk over to somebody's office and meet them and put a name to a face.
Maintain balance all the way across between work and family life.
for your sanity, make sure you have some outlet. Mine happens to be working out and fishing, but something to relax, something to get away from it so that your mind can rest also.
I think self-care is really important, and if you can prevent yourself from burning out or intervene when you feel like you're getting burnt out, that'll help in the care of your patients and help you to empathize with them.
I think the best advice I could give to new providers is just to be yourself and to know that you trained really hard to get to where you are, but you do not work in a vacuum, and it's really important that everyone that you work with is just as important in your success, and so you need to be kind to everyone and just open-minded.
Take time to be courteous, to meet everyone, make sure everyone knows who they are, and to introduce themselves over and over and over again, and just try to create an atmosphere that people want to work into.
I think as a younger surgeon, I was a little bit more aggressive and wanted things in a specific way, but then I got married and realized that wasn't going to happen, and I've just translated that to work.
Make sure your expectations with your partner are clear from the beginning. I think that the more, this is as invested as we are in our work, this is their job, and the most important thing in our lives really probably is our family.
When you start off in medical school, they talk to you about this being an art, not necessarily a science. I think the first few years of medical school and training, you focus on the science. And I think the last maybe 20 years of my life, I've focused on the art of it. And hopefully the next 30 years or 20 years, whatever I have left, will focus on that art as well.
To be a doctor requires that you sort of every day have the view that what you're doing is meaningful and that you are grateful for the opportunity for this fantastic profession, and that at the end of the day that you have made some sort of difference in somebody's life, whether that is education or whether that is treatment or whether that is just relationship. But the point is, your job has meaning.